Welcome to the Functional Medicine Doc Talk podcast. I'm your host, Dr. Kurt Woeller, talking with experts in functional and integrative health and medicine, discussing critical information for improving your health and wellness to help you live a long, full life. Let's get to it. Hi, everybody. This is Dr. Kurt Woeller. Welcome to the podcast. So in this show, we're going to have a conversation about dental issues and specifically dental toxins, which is something we should all be familiar with, particularly in this functional integrated medicine space. This is also going to allow us to kind of extend this conversation into how dental health is very important to our overall health. So none of us like going to the dentist. I mean, who does, right? But it's a very important part of maintaining our health. And then for people, many times with chronic illnesses, it's often an area that is either forgotten or maybe just not even considered. And so it's important not to have that happen. So I'm joined today by Snowy Tan, who is a naturopathic physician who has unique insights, experiences, and skill set in this particular area of dental toxins. So very interesting conversation coming up. So Snowy, welcome to the program.
Hi, Kurt. Thank you for having me.
So before we get into the discussion, give the audience a brief overview of your education and training and then how you got interested in this topic.
Yeah, so I'm a naturopathic physician trained at Bastyr University in Seattle, Washington. I'm licensed in California and Washington. And I'm an A4M fellow, a certified functional medicine practitioner, and a Bredesen Recode practitioner. So my background is I trained with an integrative clinic that focused on chronic Lyme disease in California. And then I ran my own clinic where I focused on treating chronic complex illnesses like cancer, autoimmune diseases, neurodegenerative disorders, chronic tick-borne infections, and things like that. The interesting thing is I came to medicine first as a patient. So before going to naturopathic medical school, I was an investment banker and really enjoyed my work quite a bit, but I got sick with chronic fatigue syndrome and prediabetes and asthma. And long story short, it just kind of made me wake up and help myself. I learned biochemistry and nutrition and did all this sort of stuff. But the thing that really turned things around was I ordered a urinary heavy metals test online. This was when I was in Hong Kong. And the results came back with through the roof mercury levels, lead, cadmium, arsenic, and cesium. And I was shell-shocked. So I had to learn how to chelate myself. And I had to learn where all these metals were coming from. And that was when I started to learn about environmental medicine. And I got so interested in this stuff that I quit my job and moved to the US to go to naturopathic medical school.
That's amazing. Hey, I have a question for you. So do you feel, obviously we could dive into a lengthy discussion just about what happened to you with your own health issues. I know we're going to talk about dental toxins. Metals are certainly a big part of that from an environmental standpoint. Do you feel that the metal toxins were a primary issue for you that really compromised your health? Or was it maybe a major contributing factor along with just working at a very high impact, high intense, type of profession? What's your thoughts?
Yeah, that is such an excellent and loaded question, right, Kurt? Because actually with chronic illnesses, it's never one thing. There will be certain things that are like major contributors, but it's never one thing. It's really kind of like the amalgamy of all the different factors that come together. But the way I think about this is there will be a few hidden reasons. And when I say hidden, it's things that people don't look for. And those are the things that keep people sick. And the two biggest things in my practice that I found out, and also for myself, are dental toxins and infections, as well as a chronic emotional burden. And these are the two things that physicians are not trained to look at. Physicians are not, this is not stuff that as physicians, we are actually taught to look into right from the on the onset, because it's stuff that is very tricky, The dental stuff is like, oh, this is the realm of dentists. We don't touch this. That's like basically what generally physicians will think.
Right.
And I don't blame anybody for that, right? And the chronic emotional stuff is like, well, that's the realm of psychiatrists, psychologists, or even the patient's own personal journey. A doctor cannot be going through that with 10, 20 patients that they're seeing every single day. It's a lot of burden on the physician themselves. And so these are, to me, are the hidden reasons. And it's always the hidden things that we don't know about that keep people sick, because you're addressing all of the others.
So we're going to talk about the emotional part. That's really important. We're going to talk about the dental toxin part, which is obviously very important from this conversation. Real quickly, so I have done some work with many people overseas, in Asia and Middle Eastern countries and whatnot, and invariably I find almost everybody elevated in heavy metals, from lead, arsenic, mercury. Some of the highest levels I've seen of those toxins is individuals out of China. And so it's seemed to be very prevalent. I mean, it's an issue here in the US, but we're a very large country. It depends on where you are regionally, but it's a major problem over there. And
Absolutely.
I know you know that as well. So very interesting. All right, let's get into dental toxins. So person goes to a dentist, right? They do dental care. They see the hygienist. Oh, I got a cavity. Get the cavity filled. There's all kinds of things that people can be exposed to, even beyond just fillings. You've got crowns, you've got implants, whatnot. So let's open up this discussion. What has been your experience as a physician in this field, working with people with chronic illness? What are some things that they're commonly getting exposed to through the dentist? Maybe how it affects them, how you've seen that be either a main or a contributing factor to different types of health conditions. That could be fatigue, arthritis, autoimmune, neurological. I'll let you take the lead on this discussion. So I just want to set that down. So go ahead.
Yeah, so I'll back up a little bit on, where all this comes to play. So when I was a naturopathic medical student, I trained with Dr. Dietrich Klinghardt at his clinic in Washington. And he was assessing all his patients for dental toxins and infections, right? And as you know, and a lot of people know, he sees some of the sickest people around. And then later on, I trained with Dr. Simon Yu, who's one of the most amazing integrative physicians around and wonderful human being. And he also plays a huge emphasis on that. So that was something that I was like, okay, this is important. And I found this to be actually quite connected with most chronic illnesses, especially for illnesses like cancer, ALS, autoimmune diseases, chronic infections, because of the impact that the toxins and infections have on the immune system. The toxins are basically immunosuppressive, and that sets it up for the immune system to not function when it is exposed to infections or microbes that are more tenacious, like Lyme disease, some of the viruses that hang around. So when I ran my clinic, I screened every single of my patients for dental toxins and infections. And so if we look at the metals, the amalgams are a really big culprit. We all know that. 50% mercury, with the rest usually being silver, tin, and copper. And high copper amalgams, this is something I didn't know before, but they promote even more mercury release when you stimulate them. So if you have amalgams in your mouth, with every bite that you take, the mercury is just vaporizing and then combining with the food that is then ingested. So because that's a lot of friction and impact when you're chewing your food, right? They're basically YouTube videos, and you could just go on YouTube to look at them, where dentists are basically demonstrating using a mercury detector how just rubbing a piece of amalgam, just simple rubbing with a gloved hand, just simple rubbing can release mercury vapors into the air. So can you imagine all the chewing and biting that a person does on a daily basis? And then imagine if those people also are the ones that do have a teeth grinding problem at night, where it's you're essentially rubbing the teeth, the amalgams. So that's a lot of friction and release.
Hey, Snow, are you familiar with the work of Boyd Haley?
Oh yes, I've actually read it, but I don't recall enough right now off the top of my head because I do read quite a bit. But can you tell me? Can you remind me?
And I forget where he's out of. This is going back many years ago in the autism world. So he had presented some information at many of the biomedical autism conferences years ago, where he showed you can actually watch, as you mentioned, videos of mercury vapor coming off an amalgam filling. And then also there was a study that was done, or images that were done on I think it was a sheep, where they showed mercury deposits throughout the body, hitting the major organ systems, the spleen, as you're talking about, by the way, the immune system, into the lymphatics, into the lymph nodes, into the spleen, which are all areas of major immune reactivity, particularly from a crossover between innate and adaptive immunity. So, very, very interesting. So go ahead and continue.
Yeah. And actually also the liver and the kidneys where we do most of our detoxification. And we also know that if you can't detox, then the toxins accumulate, right? And then you start to have like a vicious cycle with immunosuppression.
Right. Yeah. And one of the things I just wanted to ask you, if this ever came up in some of the education you did, I've been thinking a lot about this lately with just chronic infections that people have, particularly chronic GI infections, in things that impact the mucosal immune system. Because we know that these toxins are immunosuppressive, but people go, well, what does that mean? Because the immune system is so large, so complex, so integrated. But you think about toxins directly in the mouth, right? It certainly could have just a beginning impact on the oral mucosa, which then translates to the gastrointestinal mucosa, and just essentially shutting down or compromising mucosal immunity, which is sort of that first line defense against infections.
Absolutely. And I think people don't realize that when you get a lot of gut dysbiosis, like patients with a lot of gut dysbiosis or patients with a lot of acne, which is a reflection of what's going on in the gut, a lot of times you have to go look in the mouth. And metals in the mouth are one of the biggest reasons. I have patients coming in with full face cystic acne, and they have metals in the mouth, either like they have amalgams or they have dental brackets or retainers. And once you get rid of those things and you help them clean up the gut, so they do have to go through a gut treatment with biofilm disruptors. That actually, a lot of the skin issues go away. So the gastrointestinal system, that is definitely the first layer. And in fact, we don't realize how much elevated cholesterol, how much of the other cardiovascular issues that we have are related to what goes on in the oral and gastrointestinal system because of the dysbiosis that is created. And as we know, we learn in microbiology and medical school that you have things like gram-negative bacteria that have a higher level, that have LPS. And the human bloodstream, like the immune system, is very primed to recognize LPS. And LPS is basically lipopolysaccharide, right? It dissolves in fat. And so this is also one of the reasons why people, when they have a high-fat diet, when they're just really going on keto at the beginning, or they have a high-fat diet and they have a gut dysbiosis with lots of gram-negative bacteria, they all suddenly get a huge translocation of that LPS into the bloodstream, and you get a huge inflammatory response. And that can create a lot of inflammation, and that people get really sick as a result. And so part of that is all these toxins contributing to the gut dysbiosis, which then translocates into the blood, which then sets people up for a immunosuppressive system if you don't fix that issue. So the gut is definitely one of the first places to fix.
And I know that the gut, really the naturopathic world, naturopathic doctors, physicians, that is sort of my understanding, because my partner is a naturopathic physician too, is sort of the foundations of health, right? The really first place to look, or at least consider. So metal toxins in the mouth. Okay, so you've got mercury, tin, copper you mentioned. Are there other metals that people are being exposed to through dental work that might be problematic? I know sometimes like nickel, for example, can have a trigger on allergic reactions.
Yes.
And then the other thing,
Yes.
honestly, is, well, this could be a whole other aspect, but what do you do? How do you avoid some of these metals when you need some significant dental work?
All great questions. So the second thing I want to talk about is dental crowns. And you'll be so shocked because so many of my patients tell me, well, oh no, I don't have any amalgams. So we're still on amalgams, and then I'll talk about the other metals in the crowns. So I send them to the biological dentist, and they find amalgams right below those pearly crowns. Very typical. And the patients are just floored, right? Because they're told, I don't have amalgams, they don't see it, and they think they're okay. But usually a lot of the times the amalgams are right below the crowns, they're just covered. So then you have the metallic crowns. And metallic crowns can be stainless steel, titanium with nickel, aluminum, vanadium. You can also have like chrome, cobalt, molybdenum alloys. So this is like a whole host of different types of metals. And usually when I find patients with elevated, mixtures of these things, and I will ask them about I will check whether they have crowns, what kind of crown, a lot of times they don't know. Even if you just go to a new dentist, the new dentist will not be able to tell you what metal is in that crown. Only the dentist who put it in will know. So it becomes very complicated. And then there's something called galvanization. So we learned this in chemistry class, right? If you have two different metals that are in contact with each other, they start to form a circuit because they have differences in potentiation. So the metals will move around, get dumped. This is the worst if you actually have a gold crown. And a lot of people think that, oh, well, gold is an inert metal. It should be one of the best. It should be one of the cleanest metal, but it's actually one of the most cathodic. It's right on one end of the chart. Stainless steel is in the middle, and tin, copper, and cadmium are at the opposite end. So I don't know where mercury is because mercury is usually not featured in those charts. But if you have an amalgam touching a gold crown, good luck with that. So now you have metals moving around your mouth, they're moving into your food. It's really, really, really tough.
Any evidence with that, by the way, that it creates some sort of electrical charge?
Actually, there are actually a whole bunch of dentists on. There's something called the IAOMT, and this is what I tell patients to go to if they are if they need to find a biological dentist. So there are two organizations. One's called IAOMT, the other one's IABDM, and they certify dentists for safe mercury removal and also checking dental infections. We'll talk about infections later.
Right.
And so there's a video online on YouTube by one of the IAOMT dentists. And it's basically under it's by the official IAOMT channel that talks about galvanization in the mouth. So this is actually a real thing.
Yeah, and what about implants? I mean, that's another level of significance.
Huge. This is that's the worst, because I have patients who will come in, and that is really, really tough because when they have if we talk about, let me back up a little bit. So with dental implants, they are usually some sort of composite with titanium, and the traditional implants have the metal drilled right into the jawbone. And as we know, bone is very well perfused with blood. So you have toxic metal seeping into the blood all day, every day. And the patients with the full mouth implants are the ones that suffer the most. They're always in a lot of pain and also a lot of neurological symptoms. And the problem is you can't just take them out because they need bees to eat. And we also know that if you just remove the implants, then they start to have bite issues. Even if you have just one or two implants and you just remove them, now you have an empty space, and there are bite issues, and mastication issues actually set people up for dementia. There's actually a lot of research showing this. And one of the reasons is because it dramatically lowers BDNF. So when you have mastication issues, that's also an issue. If you
that's
take them out,
I did not know. So mastication issues lead to a decrease in brain-derived neurotrophic factor.
Yeah. and
Wow.
very
Okay.
strongly linked with
Interesting.
dementia. Yeah. And so if you remove these implants, you can't just put new ones in right away. The safe implant is called zirconium. It's a kind of ceramic. They make this out of Switzerland, but you can't just put the new implants in there. You have to like let the wound heal, and that usually takes a few months. So meanwhile, the patients are like, I just spent thousands on those implants, and now I have to get them out and wait a few months, and I can't eat properly. Then I get a really expensive set of implants again. So, it's really, really tough.
How, I mean, and we know too, we can just talk about the structural integrity of the mouth, right? Because if you think about things that cause stress in the body, yeah, toxins can cause stress, but malalignment of the jaw can cause stress. And then that stress reflects through the brain, nervous system, pituitary, adrenal axis, that whole hypothalamic pituitary adrenal axis situation. There's a lot of things that impact stress. And then stress, of course, leads to immune suppression. So it's just this sort of vicious cycle that people get into.
It's a vicious cycle. That's right. That's right.
So let's talk about there's obviously a wide variety of toxins. And so really, ideally, as somebody who's dealing with these things, really pretty much anybody, try to go to a biological dentist, somebody who's been trained through one of these organizations to be able to minimize risk as much as possible. The reality is that there's going to be people who sometimes need fillings or need crowns, or, I had a crown once because I bit into an almond and it cracked my tooth. I call it the $1,500 almond because it cost me $1,500 to get it fixed. That was years ago, So there sometimes things just happen. So in general, when you think about, we know ideally going to a biological dentist would be great. And what are some things that the regular person out there listening to say, hey, I'm in line for some dental work, whether it's implants, whether it's crowns, whether it's a filling, obviously trying to find a dentist, but perhaps that they might be aware of to say, I absolutely need to avoid, these things that would tend to cause more problems that you've seen than others, for example, in this realm of chronic illness.
Yeah, so if people absolutely need like fillings, so composite resin is better. It's basically coated ceramic particles of zirconium and silicon bonded with acrylic resins. They're stronger and they're more durable and less toxic. If you have to have crowns, the ceramic ones are best. But, I also tell my patients, you may feel like a biological dentist is really expensive, but it's really the most important investment that you can make. And the reason is because it's not just about safe removal of mercury. Well, first of all, when you go to a regular dentist to remove mercury amalgams, it's actually very dangerous for the patient. What happens is the process of removing the amalgams involves a lot of drilling and more friction. And so you get a lot of mercury vaporizing. Your mouth is wide open and you're just gasping for air and just taking all that mercury in. So you're getting a huge bolus intake, which is actually worse. When you go to see a biological dentist, you know that they're a biological dentist because they and the assistant are wearing like things that look like hazmat suits, and you get an oxygen inhaler, and they also have a dam in your mouth to reduce the mercury inhalation, and there's a huge big air ventilator pumping air out of the dental office. So that's what keeps you safe. But even after doing all that, that's when the real work begins for me with my patients, because we need to get the mercury out of the body. The stuff that you've already absorbed, we need to get that out of the body via chelation. And so it's a whole bunch of steps that you have to take. And if you feel that that's really, really hard for you to do, what I would say is save up to go to a biological dentist, because it's better to go and do that maybe at a later time versus getting a huge bolus exposure and then not knowing what to do after that. Right. So that's one of the most important things.
So do it right the first time.
Yeah. Absolutely. Yeah. Make that investment. And I have to say, with my patients who have dental issues, and I see primarily chronic complex illnesses, right? They don't get well. They don't really, really get well if you don't do the dental work. And this additional part is I want to talk about dental infections because that is one of the biggest things that even more hidden than the toxins, because most regular dentists don't look for the infections. They don't know how to look for an infection. That's not how they're trained. And I know because I actually trained with a bunch of biological dentists when I did my training on how to look for dental infections in patients. And obviously, I'm not trained as a dentist, that's their realm, but I do applied kinesiology to find out as a first screen, because my patients would be like, well, it's really expensive to go see a biological dentist. Do I really, really, really need it? Well, sometimes we use applied kinesiology to do a first screen to convince the patient to go. And so there's actually a lot of published literature out there on association between periodontal disease and cardiovascular disease. So we don't have to really talk that much about that because just they're already training dental hygienists to screen for periodontal disease, and that's covered. The two big things really are root canals and cavitations. So first off with root canals, so a tooth with a root canal is basically a dead tooth. It's got the nerves and blood vessels removed. And that removal process leaves a vacuum that the dentist will try to fill with dental cement. It doesn't really work very well, especially if they don't use ozone to kill whatever's in there, because our mouths are just full of microbes.
Yep.
And it's sooner or later that these just get infected. So almost all of my patients with root canals have had to get them pulled because of hidden infections. And the problem with pulling teeth, then you get to that problem with the mastication again, right?
Yep, right.
And so that's a very, very big thing. And a lot of patients are like, well, I don't really want to pull the tooth because then now I have a hole or I have to go and get an implant, and it sets up a dilemma there. And then the second thing is dental cavitations. And this is something that most people don't know about. So according to my biological dentist, they don't teach this in dental school. And I confirmed this because I have a patient whose son is a dentist, and he was seeing me for dementia, and his son was like, "What is a cavitation again?" So wow. that was when I knew, like, wow, dentists don't know what cavitations are. So cavitations are actually pockets of infection inside the gum, and they can go all the way down to the jaw. So this is what we are taught in school that's called osteonecrosis of the jawbone. And this usually occurs around the areas where you get the wisdom teeth removed. So every tooth has a ligament that attaches the tooth to the bone. And basically, my biological dentist friends tell me that dentists are not taught in dental school that you have to remove the ligaments when you extract the teeth. So if you have a stray ligament attached that's embedded in the gums after extraction and the wound heals over it, it's kind of like having a woman give birth and then closing her up before she expels the placenta. She's going to get septic, right? Well, the ligament's really, really tiny, so people don't get septic. But now you have this persistent infection inside the gums, and you can go on for like decades without any symptoms. And in some cases, obviously, the wisdom teeth are surgically removed, so they actually cut the gums and break the teeth inside, and they remove it, so you have a bigger wound. And again, the whole mouth is filled with microbes, and so the wound may not heal clean. And so you have a chronic infection in the area that can go all the way down into the jawbone. And personally, I am one of those people. So I actually had to go to my biological dentist and get myself fixed. I had to, they do this thing called a cone beam CT scan. And basically that allows you to see 3D into the gum and the jawbone area. And I had my 4 wisdom teeth removed when I was like about 15 years old. And I had huge infections in my, that went down to the jawbone. It was like big infections. And I had no pain. I had no mastication problems, no TMJ, nothing. But I had slight elevations in my anti-TPO. So that was when I started learning about all these things. I was like, okay, I gotta go. I was sending patients to the biological dentist, and I was like, okay, I gotta get myself fixed.
So
and my biological, I'm sorry, go ahead.
I have one comment and 2 questions. One comment and 1 question. One, so it sounds like you're saying if you're going to have your wisdom teeth out, they absolutely need to make sure to remove that ligament. So that, from what you're being told from a biological, that should be an absolute must to decrease the potential of just some sort of deep, seated infection that can just fester for decades. So the other question would be, and again, I realize every person is a little bit different. Their situation is different based on what they may need from dental or medical care. But in your conversations and working with biological dentists, what is their general feeling about just sort of automatically removing wisdom teeth? Sort of like a rite of passage, like, well, this is what we do. We're supposed to do that. Has that narrative changed? I mean, from a biological dentist perspective, would they take it more on a case-by-case basis?
It's definitely case by case.
Okay.
From my understanding and discussions with them, because you don't remove teeth unless you absolutely have to. Like, it's blocking, it's causing issues for the patient. You don't remove things that are naturally meant to be there unless they're causing a lot of problems for the person. It's a little bit like, what we've done in the history of medicine, like, oh, if we're going to open the patient up, let's just remove the appendix anyway. Like, you don't do that anymore, right? You're not supposed to do that anymore.
Right.
That's kind of the same mentality.
So what are the major infections? I mean, the mouth is full, as you mentioned, it's full of bacteria. I actually have a slide I use in some of my lectures that talks about 500 plus bacteria can reside in the mouth. Many of them form biofilms. We know the biofilm thing is certainly, a lot of the research actually in biofilms comes out of the dental profession. But so we can get pockets, we can get cavitations, we can have the retained ligament on a pulled wisdom tooth. That could be a problem, for example. I don't remember, but are a lot of the bacteria in the mouth gram-negative that produce the lipopolysaccharide? Do you know?
I do not know.
Okay.
I actually don't know about that. But I do know that one of the kits that they have is they also have a Lyme kit. I am not big about that particular test, but they use it as a first screen, and they have basically isolated like even tick-borne infections in the tooth area. So a lot of the dentists, the biological dentists, will screen their patients for chronic Lyme disease if that's not already been screened for. So that's something that is, I've had new patients come in and they told me, well, my dentist found Lyme in my mouth. Can we screen for Lyme? I'm like, yeah. So that's happened. And the patients who have the methylation and detoxification SNPs and gluten sensitivity will have a very high tendency to have autoimmune disease if they have dental issues. So I see this is like a huge correlation.
That's interesting.
We don't know which one came first, but it's that combination that predisposes people to autoimmune diseases. So I see a lot of that, especially with Hashimoto's. Like when I have a patient come in with Hashimoto's, or we find Hashimoto's in the patient, or like Graves', the first thing I definitely always look for is dental stuff. Cavitations are huge.
It's important for people to understand that you think about from a conventional dental standpoint, conventional medical dental standpoint. If you've had a heart valve replacement, if there's any sort of heart valve issues, you're almost automatically put on antibiotics because the mouth is such a seat of bacteria that can get into the body and create problems. So this is not a stretch to think that the mouth and the retained bacteria in places where it shouldn't be could be problematic from a triggering either a systemic infection, local infection, an inflammatory reaction that has systemic potential. And then you always have the issue of what's called cross-reactivity, to pathogens, damaged tissue, to other tissue in the body. That's where you develop these autoimmune problems. So what, sort of in general, what can people do? Obviously, a biological dentist going through all that. But what can people do from a preventative standpoint, to, work on oral health, decrease the potential for these accumulating problems? And maybe even in some cases, because not every situation is perfect, but what might somebody do if they've had some of this dental work done where it's not ideal? Obviously, they need to get the metals out, et cetera. But are there some things that you've done that people maybe can take, or just at least decrease some of the negative impact that some of these toxins can have?
From the dental perspective, obviously I leave a lot of, when patients go see a biological dentist, the dentist will give them a lot of guidance.
Sure.
I do tell my patients that there are a couple of things you definitely want to do. I actually recommend that they get an electronic toothbrush that has basically sonic technology, as well as a blue LED light. So the blue LED light actually kills quite a lot of microbes. And the main thing is you want to aim the toothbrush at the junction where the teeth and the gums meet, because that's where a lot of the stuff gets into trouble. And obviously the broad surfaces, right? And then nutrition is a huge one, right? What we put in our mouth, what we make ourselves chew, and then goes down into our gut. Because sometimes a lot of the microbes in the mouth are there, not because they're just there, but they're coming up from the gut. So especially patients with very severe gut dysbiosis, they're not really digesting their food. The food is kind of fermenting in their gut. Then you see a lot of correlation between what they're having in their mouth and also what they're having in the gut. And we also know there are so many studies, literally tons of it, because I was looking at this, huge correlation between a bacteria called Fusobacterium, which is actually an oral microbe, and colorectal cancer. They've literally so much research on this, research where they've taken tumors out and they find Fusobacterium in the tumor, huge enrichment of it, abnormal levels of Fusobacterium, something that is actually really should be in the mouth. So there are two different things. There's a failure of digestion. So we're talking about not enough gastric acid digesting and killing the microbes that are coming in from the mouth, but also a huge correlation between what's happening in the mouth and what's happening in the rest of the gut, and obviously on a chronic complex illness perspective. So it is actually a big thing. So I have my patients use those the electronic toothbrush or the blue LED light, and then they also need to floss with a regular dental floss, and then with a water pick. So it's one of those flosses that shoots out water, and I have them alternate, or if they're in a really critical time period, I have them use a few drops of povidone iodine in the water reservoir. So then basically they're flossing with a regular floss, then with the water pick, so that basically you're really having a clean mouth. You don't want to overdo it all the time, because there are good, healthy microbes that you want to keep in the mouth. They keep the mouth healthy. They keep the tissue healthy as well.
I think it's important to realize that the mouth has its own microbiome, and it's connected obviously to the rest of the microbiome, although you're going to have certain bacteria at high, like you say, this Fusobacteria in the mouth. The other thing I would add to that is, I'm a big advocate of go to your dentist and see the dental hygienist, have them do deep cleanings. I mean, I know people who have avoided doing that and have major problems, even though they floss and they water pick and they brush every day. Sometimes you just can't get at deep layers. And the older we get, too, there's natural sort of recession of tissues, and things just start to, they're not like they were when we were 20. When you start getting older. So that's a big one. I want to move on to, I want you to mention just a few things about ozone, because in the context of this, but real quickly, in your experience, when you talk about people with chronic health issues, and again, that could be cancer, that could be autoimmune, that could be chronic fatigue, it's sort of its own spectrum. Where would you put dental problems on that list of things that are major contributing factor to people's health? Because we hear a lot today about, well, don't forget about mycotoxins, and don't forget about environmental chemicals, and you got Lyme, and people go, oh my God, there's so many different possibilities. But where would the dental, in your experience, the dental component fall on that list?
That's an interesting question, because I think about things not in terms of hierarchy or ranking, or the way I think about things is what caused what. So I think when we see patients, the things that are clearest that show up in the lab tests are things like chronic infections. So I screen all my patients for a whole host of chronic infections. Nutrition is really easy to implement. It's very straightforward, and everybody who's not well or chronically unwell should be paying attention to nutrition. And then the question we have is, why are these chronic infections persisting? Like, why do some people get well from COVID? It's like a flu for them, or it's just like a cold for them, and other people have to be hospitalized. So then you need to take one step back to thinking about, okay, why is this patient not able to address the infection on their own or with like minimal help, like, rest and maybe if you have a bacterial infection, a simple round of antibiotics might be able to take care of it. If you have, why do people have persistent candida problems? Then we go back to this immunosuppressive level, right? Why is the patient's immune system not able to take care of itself? And then there comes environmental toxins and dental toxins are part of environmental toxins. And then the chronic infections are another lower level because they keep the system busy. So if there is always something in your blood that signals that there's an invader, then your immune system is always on alert. And as a result, you're always going to get chronic inflammation. And if you're busy dealing with this lots of small little perpetrators, when a big perpetrator like COVID or whatever comes in, then you're less able to deal with that because your immune system is maxed out. And so I look at those pieces of the puzzle separately, but as in the context of the patient. And then there's the emotional burden problem, which is also immunosuppressive, right? And where I see this is the thing. This is where ozone comes in because the biological dentists use ozone. It's very, very important. It's very important as an antimicrobial agent that is non-toxic. And so it doesn't stay around. And the reason is it doesn't stay around for a very long time. And the mechanism of ozone is, we know that ozone is made out of 3 oxygen atoms, right? The structure is such that the third oxygen atom is inherently unstable and it wants to dissociate. And when it dissociates, it will scavenge free radicals because it's a free radical looking to close off its circuit with another free radical. And then so it neutralizes free radical. And what you have left behind is oxygen gas. And we know with a lot of chronic illnesses, they have low oxygen environments, just poor perfusion, lots of free radicals, and that is where ozone really shines. So ozone is used in so many levels. In the dental perspective, they use it to sterilize, clean up the wounds before you close them up. They use it to remove the and they use it to actually help. We do something called prolozone, which is something you can inject. So if I had a cancer patient, for example, with active cancer, they cannot have any dental work done on them. Even though we know that they have metals, even though we know that they have cavitations and dental infections, you cannot do any dental work because the process of doing dental work actually is quite inflammatory for the body. When you're cleaning things up, when you're cleaning a lot of, the process of removing the amalgams or like doing dental surgery it's like a huge stress. It's almost like a small trauma for the body. And the body is now busy dealing with cancer. It cannot have another big trauma come in. And so you have a situation where we know that this is the root of the problem, but we cannot address it now because doing so will worsen the cancer. Or if the patient just got well from cancer, it can reactivate the cancer. And so basically with these patients, what I have them do is they go to the biological dentist and they get prolozone shots where they get ozone injected into the location of the infection. So it temporarily reduces the activity there because it neutralizes quite a bit of the infection, but you cannot really get rid of the entire infection unless you really open up and remove all the tissue, all the dead tissue and things like that. So this is kind of like a stopgap. Yeah. And then
Yeah, I think in the ozone, I mean, that's a whole, we need to have another discussion about ozone, honestly.
Yeah.
Now, I want to get into the emotional piece, but real quickly, I just want to ask you, so the general recommendation on not having dental procedures done if somebody has cancer because you can trigger more inflammation, I'm assuming that doesn't mean general hygienist care. where you're just going in for maintenance care. You're talking more about more significant types of interventions, whether that's implant or what, can you define that a little bit more?
So general cleaning is generally fine, but if they have to do deep cleaning, I will generally tell them not to do that.
Okay.
Because deep cleaning, I don't know if you've done deep cleaning. When people do deep cleaning, they can get kind of have like flu-like symptoms for the next few days. And that's because that process, like you're bleeding a lot, right? You're bleeding a lot, and basically plaque is biofilm. Is hardened biofilm. And so there's a lot of like microbes that in there that you do not want your blood to be exposed to. But when you do deep cleaning, that's basically what happens. And so I would not have my active cancer patient do deep cleaning. This is something that we'll have them put off until we get them into remission, or we get them into stage where they're really, really stable and they're feeling much better.
Yeah, the deep cleaning is not fun. So this goes back to prevention. So the water pick, important. The brushing, the povidone iodine, just do that. Just, keep your hygienist appointments, maintain a good schedule. Don't go to the level of having to do a deep cleaning. So people might ask, well, why would you talk about emotional burdens in a typical podcast interview about dental toxins? But I want you to take the lead on this, as we kind of, finish this out, because this is something I've seen. I know you have seen as a naturopathic physician. I've worked, with people with chronic illness for decades now. It is a critical area that needs to be recognized, appreciated, and dealt with. Otherwise, they're not going to get well. And so it keeps people stuck in these persistent patterns of inflammation and dysfunction. So let's talk about that. The emotional burdens, its influence on chronic infections, et cetera. Go ahead. Yeah,
you totally hit the nail on the head, Kurt. And this is something very close to my heart, because this is the one thing that patients have to do by themselves if they really want to get well. Whether they see a therapist or they work on it themselves, it's actually a very personal journey. And the ones who refuse to take this personal journey, the ones who are in denial or they're afraid of the feelings, they don't get well. And everything we do as providers just becomes very difficult. Like nothing works. The patient will be in pain. They will complain about everything. They get all the side effects. They feel it big, and they're not lying. They are in serious pain, and they're in a deep, dark place, and the pain is actually very real. And that's because a large part of the pain is psychogenic. When I say psychogenic, I don't mean that the patient's making it up. What I mean is that the pain is mediated by the nervous system, and specifically is the combination of the limbic system and the autonomic system, both of which are not in the conscious control of the patient. So this is where, we get a disconnect, because with a lot of, we get a lot of complaints in the medical society that, our patients say, doctors are not compassionate. They're saying that I'm making this up, it's all in my head. And the patients feel really like left out. But the doctors are not trained to do this. So there have been a lot of studies and books written by medical doctors. And I would encourage people to read a few books by the Dr. John Sarno. And he's basically shown that a very large part of chronic pain is triggered by the limbic system in response to an external stimulus that reminds the patient subconsciously or unconsciously of traumatic events in their lives. And these reminders will trigger the emotions that are suppressed, but then the emotions are too painful for the person, and so the nervous system uses pain as a form of distraction. And what the unconscious really wants to do is bring those thoughts and those emotions into the conscious so that the person is aware of it. But then it's like, you're trying to keep a lid on something. You're trying to push a balloon underwater and keep it underwater for a long time. But once you bring those suppressed emotions into the conscious, the nervous system doesn't have to use the pain distractor anymore. And so the pain goes away, but now the patient has to deal with the emotions and the traumatic event. So, this is a topic that's really, really deep, right? But personally, I'm most interested in empowering people to take back their personal power, because this is the one thing that people can do, because really, this is about their own journey. And this is about, the chronic illnesses are they kind of serve a spiritual purpose. They serve a purpose to help the patient learn more about themselves. And it's also something that they triumph over. And this is like my number one goal in my career right now. So self-empowerment was what triggered me to move from banking to medicine. And I kind of want to make sure that, I want to share this with people because nobody knows our own bodies better than ourselves. And there's nothing more empowering than to triumph over an illness and knowing why it happened and what you can do if it happens again, whether it's to yourself or somebody else. And once you learn the skill, nobody can take that away from you. So I've actually, go ahead.
Yeah, I want to say, before we get to what the programs that you like and you're also developing, I want to add that this limbic system, because you pull in the vagus system as well, the polyvagal aspects, is not just pain. It is emotional triggers, it's fear, it's anxiety, it's depression, it's sleep problems, but it even goes to the level of just reactivity to things in the environment. It's true, mast cell reactivity gets primed, gets hypersensitized to things in our environment, but if you're locked in this state of this fight or flight, this chronic stress response, you might even call it the cell danger response scenario, your body can react in other ways. It might be you're overreacting to allergies, or you might get skin manifestations, or like you said, chronic pain. So and I know you know this, because I know you're using pain as an example. So I just want people to understand that it can manifest in many different ways, physiologically, symptom-wise, but even from a mental, emotional standpoint. So what are some of the programs that you like and things that you develop or are working on now with regards to this particular area?
Yeah, so I've actually designed a program to help people understand the roots of their chronic emotional stresses. And this goes to, we address different emotions like anger, resentment, or like fear, guilt, shame, and things like that. But we look at the roots of those, and they, some of them are related to how we grew up as a child. And this is not about blaming. This is more about helping people understand so then they can actually help release these emotions. So things like, abandonment, feelings of, having a father wound, a mother wound. Also, how these actually set things up for different behaviors as an adult, and their relationships with other people. And then I teach them techniques that they can use to release these emotional burdens. And so I'm working actually with a faculty member at the University of Washington to set up an interventional study where we're looking to recruit patients with active cancer. So we're just using cancer as a first step because it's easier to track outcomes with that, but we will roll that out to other chronic illnesses as well. So they'll go through the program, we'll track the responses after completion. And also for these patients, I want to see over the longer term if there is an impact on overall survival. So this is still pre-IRB, and I don't want to talk too much about the program itself, but I just want to let people know, especially providers, because then you can help us get patient participants when we're ready. But I totally agree with you, Kurt. This is the huge thing, and the piece that you talked about, the body response. Because let's say when you were 4 years old, and there was an incident where you got bullied by a bigger boy, the level of intelligence that the stored emotions have is that of a 4-year-old. So say today you're standing next to a huge guy, you sort of feel anxious again, and you don't really know why. And your subconscious is thinking you're back in that 4-year-old body. You're back as a 4-year-old experiencing this all over again. And you can say, well, I'm in the adult now. It's not a big deal. But that's not how it works for your subconscious. And it's not just that experience of that person standing next to you that was stored. It was everything that was at that moment when you experienced it. So if it was a time when there is like lots of pollen, then your body just records all of that. Like that was a time when there's a lot of pollen in the system. And so now you have like, you can have like, sensitivity to pollen as a result. And you don't know why you have sensitivity to pollen. And maybe that was in springtime that incident happened. So these are things that can basically come back and trigger the individual. And
that's
and then
and so that's very interesting. And that's a great point when you think about some traumatic event that happens that's imprinted into the nervous system.
yeah,
In many regards, it gets imprinted in the immune system. And so
that's right.
what people often don't realize about their immune system is the immune system is a sensory system. Now, it obviously reacts against and goes after things, but it's sensing things in our environment. It's sensing the presence of
Absolutely.
pathogens. It's sensing these things called danger associated molecular patterns. All of that. That's a great point in that for people to visualize you had something happen. It doesn't have to always be a traumatic, like an accident. It could just be an emotional thing. What
Absolutely.
was happening around that same time? I love that pollen. That's great. That pollen scenario. So yeah, go ahead.
Yeah, and so I have patients with it's allergies are a big thing, and a lot of times the other thing also is when we talk about like traumatic events, like there can be a lot of pain and shame and guilt associated with it, and it can also induce feelings of rage, and rage is like it's there's a component of violence associated with rage, and that makes people very scared when they feel like, oh my god, I have this rage in me, I'm going to do something that I'm going to hurt myself, I'm going to hurt other people, so we suppress it, and the more we suppress it, it's the worse it is. So you ask about some of the modalities that I like. There are a couple of things. Basically, there is understanding the sources of why these feelings came about, like why you have certain tendencies in life. But then there's also body centered treatments. This is very helpful for trauma. So trauma can be, trauma doesn't even have to be like obviously there's a really rough trauma, things like rape and abuse, but there's also motor vehicle accident. If you went through a car crash or you had to have surgery, or as a 4-year-old, 5-year-old, you have to go get a dental procedure, and that was very traumatizing. That can also be something that's stored in the body. And when it's stored in the body, you have to use body-centered treatments or body-centered therapies that help the person release them. So it's really a combination of both mind-centered and body-centered. And I'm also a certified hypnotherapist. So that's something that I use to help people bring feelings and knowledge of trapped emotions that from their subconscious and unconscious to their conscious, and to use visual imagery to release those. And then there's also things like tapping. There's have techniques called like heavening. Those are actually very, very helpful. And for somebody in that journey, usually it's a combination of different things that really work.
Right. So I think as the kind of the take-home message of this conversation, the way I look at it, there's so much we could talk about more, and I'd love to have you back for further conversations on various topics. So, by the way, I made my original training as a cranial osteopath. So
I love craniosacral therapy. Yeah, I train in that too.
Was inherent in my early training, my profession. I mean, so I still carry those tendencies, those philosophies, those things as part of my overall work. But as a take-home, sort of to summarize and wrap this up, my feeling is that there's people out there struggling. And if there's practitioners listening to this who have patients they're dealing with who are, let's just take the person they've done all the testing. Their diet is impeccable. They're working on infections. They've done all kinds of body work, etc. And things are just not moving. They may have improved somewhat, but they're still stuck. They're not over the hump. Well, clearly there has to be part of this equation and process, mental, emotional work. Because again, it's not just, I'm going to go talk to a psychiatrist and, all that. No, this stuff is locked. It's part of the intrinsic aspect of your nervous system, your limbic system, like your autonomic nervous system, like you mentioned. These aren't things you really can control. They're part of your cellular biology reactions. The other part is if you're not making progress or you're still stuck, you got to get in the dental component. So these are areas that I think even in the world of functional integrative medicine, clearly in conventional medicine, it's totally overlooked for the most part. But in the world of functional integrative medicine, it is also, I think, to some degree, underappreciated, you're one of the first I've seen really kind of talking about the major importance of the dental aspect. I know Dr. Klingart and others as well that have been out there for many years. But this is not a topic that I think that is discussed enough, where it's not recognized enough.
I absolutely agree.
I really appreciate having this conversation. So let's summarize. So action steps, some basic things that people out there listening, what are some things tips, suggestions? We talked about some of the stuff from a dental standpoint, right? Making sure you keep up with your dental hygiene. But just, a few tips or suggestions to summarize, and then some resources where people can access some of your information or maybe what you're into next.
Yeah. So in terms of the emotional aspect, I think starting a meditation or some sort of a meditation is something that would be very, very helpful for people. And I like to point people to like free resources. So there is a free app called UCLA Mindful. Basically, that is an app made by the University of Los Angeles, and they actually basically have these meditations that can get people started. If you've never done meditation before, that's something that's going to be very, very helpful. It gets you started. If you're a bit more advanced, there are things like there's a company called Mind Valley. I think it's becoming very, very popular now. They do have a lot of different people who teach different types of meditation and different types of mind-body ways to access the mind-body. Some of it's really, really advanced, but it's also something to look into. And then there's also frequency music. There's something called Safe and Sound. I think people who do pediatric therapy will also be familiar with that. But this is the same guys who are involved with the polyvagal theory.
Yeah, I think that's Stephen Porges, right? Yeah,
that's right.
Yeah.
So basically, they have frequencies that can be very, very helpful. That it's a little bit expensive because it's practitioner focused. It's basically you have to go to a practitioner or be set up with a practitioner to do that. And if affordability is an issue, there are actually a lot of frequencies on YouTube that have been, they're basically at levels where you can help the body calm down. And when you can calm down more, it's easier to start meditation. It's easier to start things that calm the body down. And that actually also relates to the vagus nerve. So it actually helps to stimulate the vagus nerve and induce that feeling of relaxation so that you're not as easily triggered. So these are first steps. But if you know you have trauma, some of the body-centered therapies like somatic experiencing, like NET, can be very helpful. Neurofeedback can also be very, very helpful. Different modalities will speak to different people. Because some people will want to know a lot of the science. Some people are more like touch focused. Reiki can be very helpful. I'm also a certified Reiki practitioner. So there are many, many different things. I would say the main thing is to find something that works for you. And that is the difficult part.
Yeah.
Yeah.
Well, and I think, to finalize, the first thing is to recognize that needs to be addressed. That is
Absolutely.
Not something that can be skipped and passed over, or we'll stuff away in the closet, and deal with it later. It needs to be dealt with now as part of this healing process. Well, Snowy, it's been fantastic, great information. Really, every interview I do, I learn something new. Appreciate all the work that you do, and thanks so much for joining me.
Thank you. I'm so happy to be here.
Take care.
You've been listening to the Functional Medicine Doc Talk podcast with Dr. Kurt Woeller. For more information about this podcast, go to functionalmedicinedoctalk.com.